Social connections, the intricate web of relationships that people form with others, have always been a fundamental part of human existence. These relationships, whether with family, friends, colleagues, or even casual acquaintances, provide individuals with emotional support, companionship, and a sense of belonging. In recent years, there has been a growing body of scientific research that underscores the profound impact social connections have on our physical, mental, and emotional health. This video will examine the importance of social connections for health, delving into how they affect well-being, longevity, and quality of life, while also examining the risks of social isolation and the challenges modern society faces in fostering meaningful relationships. The idea that social connections play a crucial role in human health is not new. For centuries, philosophers, writers, and religious leaders have extolled the virtues of friendship, family, and community. However, it is only in recent decades that science has begun to provide empirical evidence of the extent to which social relationships influence health outcomes. The pioneering work of researchers like Julianne Holt-Lundstad and John Cacioppo has brought attention to the links between social relationships and health, demonstrating that individuals with strong social ties are more likely to live longer, experience lower levels of stress, and recover more quickly from illness. One of the most significant findings in this area of research is that social connections are closely linked to longevity. Studies have shown that individuals who are more socially connected live longer than those who are socially isolated. In fact, the impact of social isolation on mortality risk is comparable to that of well-known risk factors like smoking, obesity, and lack of physical activity. A meta-analysis conducted by Holt-Lundstad and her colleagues in 2010 found that individuals with strong social relationships had a 50% greater likelihood of survival over a given time period compared to those with weaker social ties. This effect was consistent across age, gender, and health status, highlighting the universality of the protective effects of social connections. The mechanisms by which social connections promote longevity are complex and multifaceted. One explanation is that social relationships provide emotional support, which helps individuals cope with stress and adversity. Chronic stress is known to have detrimental effects on health, contributing to a range of conditions such as cardiovascular disease, diabetes, and depression. Social support acts as a buffer against stress by helping individuals feel more secure and less threatened in the face of challenges. For example, knowing that one has a friend or family member to turn to during difficult times can reduce feelings of anxiety and helplessness, which in turn lowers physiological stress responses such as elevated blood pressure and heart rate. In addition to buffering against stress, social connections also encourage healthier behaviors. People who have strong social networks are more likely to engage in health-promoting activities, such as exercising regularly, eating a balanced diet, and avoiding harmful behaviors like smoking and excessive alcohol consumption. This is partly because social relationships provide individuals with role models, encouragement, and accountability. For instance, a person who belongs to a walking group may be more motivated to stay active because they enjoy the companionship of their fellow walkers and feel a sense of responsibility to show up for group activities. Similarly, people with supportive friends and family members are more likely to follow medical advice and adhere to treatment plans, which can improve health outcomes for individuals with chronic conditions. The impact of social connections on mental health is equally profound. Human beings are inherently social creatures, and a lack of meaningful social interactions can lead to feelings of loneliness, depression, and anxiety. Research has shown that loneliness is associated with a wide range of mental health issues, including increased risk of depression, anxiety disorders, and cognitive decline. The psychological toll of loneliness is particularly concerning in modern societies, where social isolation is becoming more common due to factors such as urbanization, the rise of digital communication, and changing family structures. In many developed countries, people are living more solitary lives than ever before, with an increasing number of individuals reporting that they feel lonely or socially disconnected. The consequences of loneliness extend beyond mental health. There is growing evidence that social isolation can have direct physiological effects on the body, contributing to the development of a range of chronic health conditions. For example, loneliness has been linked to inflammation, immune system dysfunction, and increased risk of cardiovascular disease. One possible explanation for these effects is that loneliness activates the body's stress response, leading to chronic low-level inflammation, which is a known contributor to many diseases. Additionally, lonely individuals may be less likely to engage in health-promoting behaviors, such as regular exercise and seeking medical care, further exacerbating their health problems. While the negative effects of social isolation are clear, it is also important to recognize that not all social connections are beneficial for health. The quality of social relationships matters just as much as, if not more than, the quantity. Toxic or strained relationships can be a source of stress rather than support, and they can have a detrimental impact on both mental and physical health. For example, individuals in abusive or highly conflictual relationships are at greater risk of developing depression, anxiety, and stress-related health problems. Moreover, chronic exposure to interpersonal conflict has been linked to increased risk of cardiovascular disease and immune system dysfunction. This highlights the importance of cultivating positive, supportive relationships that enhance well-being rather than undermine it. The role of social connections in promoting health is not limited to individual relationships. Communities and social networks also play a crucial role in shaping health outcomes. Strong, cohesive communities provide individuals with a sense of belonging and social capital, which can enhance overall well-being. Communities that foster social interaction, mutual support, and collective problem-solving tend to have better health outcomes than those that are fragmented or socially isolated. For example, neighborhoods with high levels of social cohesion have been shown to have lower rates of crime, better mental health outcomes, and improved access to health services. This is because cohesive communities provide individuals with a sense of safety, shared responsibility, and access to resources that can improve their quality of life. One striking example of the impact of community on health comes from the study of so-called blue zones, regions of the world where people live significantly longer and healthier lives than the global average. These regions, which include places like Okinawa in Japan, Sardinia in Italy, and Ikaria in Greece, are characterized by strong social networks, close-knit communities, and a high level of social interaction. Researchers studying these populations have found that their longevity is not solely due to diet or genetics, but is also heavily influenced by the strength of their social connections. In these regions, people tend to live in multi-generational households, participate in communal activities, and maintain close relationships with friends and neighbors throughout their lives. This sense of social integration appears to play a key role in promoting health and longevity. Given the importance of social connections for health, it is concerning that many individuals in modern society are becoming increasingly socially isolated. Several factors contribute to this trend, including the rise of digital communication, changes in family structures, and the growing prevalence of single-person households. While technology has made it easier for people to stay connected with others remotely, it has also led to a decline in face-to-face interactions, which are crucial for building deep, meaningful relationships. Moreover, the use of social media platforms, while providing a sense of connection, can sometimes exacerbate feelings of loneliness and social comparison, particularly when individuals feel pressure to present a curated version of their lives online. Another challenge to fostering social connections in modern society is the increasing fragmentation of communities. In many urban areas, people live in densely populated neighborhoods, yet have little interaction with their neighbors. The decline of community institutions, such as churches, clubs, and civic organizations, has also contributed to a weakening of social ties. In the past, these institutions provided individuals with opportunities to meet others, form friendships, and engage in collective activities. As participation in these organizations has declined, so too has the sense of social cohesion that once bound communities together. The COVID-19 pandemic further exacerbated the issue of social isolation, as lockdowns, social distancing measures, and remote work led to a dramatic reduction in in-person interactions. Many individuals, particularly older adults and those living alone, experienced heightened levels of loneliness and social isolation during this time. The pandemic highlighted the importance of social connections for health and well-being, as well as the need for innovative solutions to help people stay connected in a world that increasingly relies on digital communication. To address the growing problem of social isolation and its impact on health, it is important for individuals, communities, and policymakers to take action. At the individual level, people can take steps to strengthen their social connections by prioritizing relationships, reaching out to others, and participating in social activities. While this may require effort, particularly for those who are introverted or have busy schedules, the health benefits of maintaining strong social ties are well worth it. Simple actions, such as calling a friend, joining a club, or volunteering in the community, can go a long way toward building and maintaining meaningful relationships. At the community level, efforts should be made to create environments that encourage social interaction and connection. This could involve designing public spaces, such as parks and community centers, that facilitate social gatherings, as well as supporting local organizations that provide opportunities for people to come together. Schools, workplaces, and healthcare institutions can also play a role by promoting social interaction and providing resources for individuals who may be at risk of social isolation. Policymakers can also help address the issue of social isolation by implementing policies that promote social cohesion and support individuals in building and maintaining social connections. This could include funding for community programs, initiatives to reduce barriers to social participation, such as transportation or childcare support, and public health campaigns that raise awareness about the importance of social connections for health. Additionally, policymakers can work to address the structural factors that contribute to social isolation, such as affordable housing, urban planning, and the availability of public services. So, what do you think of our video? Let us know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button before you go. Thanks for watching.